you hear stories about people being treated like a number at an IVF clinic, and that was very much my experience. I remember freaking out to my husband saying like, oh my God, they just charged the credit card the thousands of dollars that this retrieval is costing, and now I can't get a hold of them on the day that I need to start medication.
Hey everyone, I'm your midwife, Tanya Tringali. Welcome to the Motherwit Podcast, a show about the issues we, healthcare consumers and providers face every day as we interact with the medical system. We'll talk about its blind spots, shortcomings, and share strategies we can use to feel seen and heard, no matter which side of the table we sit on. Are you pregnant or a new parent looking to ensure a better postpartum experience? Or are you a birth worker looking to improve your postpartum care skills? Check out Thriving After Birth, an online self-paced course by me, midwife and educator Tanya Tringali. It's 10.5 hours of video content featuring experts in lactation, mental health, pelvic floor health, pediatric sleep issues. You also get worksheets and a workbook, as well as options to have a one-on-one session with me. Sign up at motherwitmaternity.com/thriving, and let's improve postpartum care together. My guest today is Star Lee. She's joining me to share her fertility journey. When I asked Star for a little info on what makes her story unique, she said, "I don't know that my story is unique, but rather I think IVF and fertility aren't discussed openly enough. But I do also have thoughts on the care of patients going through IVF." Meanwhile, as I read through what she shared with me, I heard lots of things that make her story unique, or at least super interesting and relevant to the things we talk about on this show. First, she had an easy time getting pregnant at age 40, and then after her first birth and 20 months of breastfeeding, when she didn't hit the first ovulation jackpot a second time, she intuitively knew that time was of the essence if she and her partner were serious about having a second child. I'll let her share her own story, but this is definitely a story of being proactive by someone with a strong sense of self and a natural ability to advocate for herself. And even still, it was a difficult experience that she's still sitting with and working through, despite beautiful babies and joyful births. Okay, enough from me. Star, welcome, and thank you so much for joining us today.
Thank you. I'm glad we were able to make this work out.
Me too. All right, before we dive in, tell us all a little bit about yourself. I know you'll tell us much more as the story unfolds.
Well, I am now a mom of two. As you mentioned, I had my first baby at 40, and now my second one, I was 44 when I had him. So I had a very long career in fashion design in Los Angeles. I was kind of ready to leave that area of my life and leave that career and move on when I met my now husband, and we decided to have our first son. So like timing wise, it felt like a good time. I think I mentioned to you that we decided to have our first son about 2 weeks into dating. So we decided very quickly that we were going to have him. But being 40 and, kind of being realistic about how this was going to happen, I met with my OBGYN and had the day 3 hormone tests. Mm-hmm. And just so I wasn't giving my partner like an unrealistic hope that we were going to have kids. I kind of, I had no idea where I was fertility wise. And prior to that, I had always been trying to not get pregnant. So this is a big twist in the way that I was going about things. And, but I got the blood work back. It was wonderful. It was excellent. But my OB, she did say, she's like, well, this is the blood work, nothing to do but try now, because that's what's really going to tell you. Mm-hmm. We waited a few months into dating until we tried, and we got pregnant 5 months into dating. And as you said, it was,
For our listeners, we have a baby that's nursing and napping, so you might hear some baby noises, and I'm getting the pleasure of staring at this beautiful little baby. But that's what you might be hearing if you hear interruptions or funny little noises.
Sorry about that.
No. I kind of want to touch on the fact that you did not even think you wanted children for a long time. Like that was part of your sense of self. And this, am I right that this happened for you? This change was fairly sudden when you met your husband. I mean, clearly you were talking about getting married and having kids very quickly. But tell me a little bit about that evolution, because I think you also said something that is interesting and a little bit counter to that statement. You said something like, there was this voice talking to me about motherhood and I didn't know what to do with it. There was something like that.
Yeah. Okay. Well, so as I said, I had a long career in fashion. That was really kind of my focus in life. Throughout my relationships, even my like more serious long-term relationships in my life, children was not in the discussion. And so I was living a very happy life. But in 2015, I started to do some shamanic work, and I started practicing with plant medicines. And during one of my journeys, the whole thing was basically, this is what it is to be a mother. And I came out of it not really knowing what to do with that information, because I wasn't planning on having children, and I was like, well, I'm not planning on having kids. I don't think this is about me and my mom because I get along with my mom okay. Like it was so I was like, maybe it's like a creative project. I need a birth or something. I didn't really know what to do with it. And just through different like meditation practices and different things, I've done like breathwork journeys and just a lot of different spiritual based practices that this kept coming up. And I would do this thing in like the early morning hours between waking and between sleep and wake, where I would say like, okay, if this is really supposed to happen, like make it so obvious. Like I can't make this kind of decision on my own, or not even that. I don't know how. Like I need a partner. Like who's even the father of these children, And so it was very interesting how when I met my husband, he was very quickly like, I think you're supposed to be the mother of my children. And it was very clear. And, so we just kind of dove in and went for it.
Interesting. I love it. Okay. So back on track of your story. I just thought that was an interesting aside. And I'm actually really grateful that I asked you to elaborate on that, because I'm a pretty literal person. And so I was like, what does it mean to have this like voice talking to you about motherhood while you were so clear about not? And now I get it.
Yeah.
Okay. So, first pregnancy, spontaneous, pretty quick. You're super stoked. Like everything's going smoothly there.
Yes. I mean, I wouldn't say it was totally spontaneous. I was doing ovulation tracking and I knew how to do timing and all of that.
Sure. But when I say spontaneous, just for clarity of our listeners, there were no assistive medications, hormones, technology involved, right? You had a spontaneous pregnancy. You were just being scientific about the process because you understood your chances were a little bit lower simply based on age. Yeah?
Right.
Cool.
Right.
Okay. So if there's details about your first experience that you think are really relevant to getting into the second pregnancy, please stop me and add those details, because I know that there is room for drawing some comparisons to the experience.
Yeah, I mean, just the fact that, like what you mentioned, it was just super easy. It was so easy that when we got pregnant, it wasn't until, a couple of years later that we realized how fortunate we were and how easy we did have it.
Got it.
It was so easy that we didn't know how easy it was.
Well, and on that note, you also comment on the fact that you were completely unaware of the concept of egg freezing and all of these things.
Right.
And that, as I understand, that's something that you kind of wish were better incorporated into the care of younger people, perhaps people in your situation who are thinking, maybe I don't want kids, or especially the people who say, I do, but I don't know if or when, right?
Mm-hmm. Yes. And, that's one of those things where I have never in my life, I've seen, a number of OBs throughout my life, from Planned Parenthood to private doctors, I've seen so many different doctors. Nobody ever brings this up at all. with anybody. It's only what type of hormonal birth control do you want? That's really the basic question that you get asked, and which was always interesting for me because I actually don't like hormonal birth control for myself, and I used tracking methods for myself. And, it just seemed that doctors were very focused on hormonal birth control for young women. And that was really the only discussion that was ever had.
Yeah.
So I think that, this could definitely be something that doctors bring up to young women, especially young women, like you said, who really know that they definitely want to have a family, maybe just not right now.
Yeah.
I think it's very important for those people to be having these discussions.
Yeah, and this is something that we call in medicine and in midwifery, we call preconception care. And it's something that is done very poorly throughout the United States, quite possibly throughout the world. And preconception care should look like a lot of different things. Basically, if somebody tells you that they're trying to avoid pregnancy, well, then you take them down that path. But if they tell you that they are considering pregnancy anytime in the near future, you take them down that path. But that is ignoring a middle pathway that you fell into and that many people fall into, which is, okay, currently I'm avoiding pregnancy, but I have a future that might involve children, and if we don't talk about that, I'm limiting my options.
Right, for sure.
And so we talked about this on the show actually a good while ago now in an episode that's called Supporting Single Parents by Choice with a midwife named Betsy Freeman. So for our listeners who want to dive a bit deeper into what this experience looks like for somebody else in a different set of life experiences, that's a great episode. But this is only the second time we're kind of diving into this topic on the show. And so that's kind of why I'm really grateful to have your experience. Okay, so now let's go a little bit deeper as you talk about wanting of baby number 2.
Yes. Well, we always knew that we wanted more than one. So as you mentioned, I breastfed for 20 months with my first son. My cycle started back at 14 months. We tried to, with doing the same things that I was doing before with the ovulation tracking for like 6 months. And then at the 6-month point, we kind of thought it wouldn't hurt to do a consultation and talk to an IVF clinic. So I did that. And when I spoke with the doctor, she brought up a really good point too, that IVF and the whole idea of it being totally new to me, I hadn't thought about, was that she said, do you think you would want even more than one child? Mm-hmm. And I was like, well, yeah, I could see us wanting 3 if we could have that. And so she really suggested going right into IVF as opposed to doing an IUI, because she just thought that getting the eggs out and preserving them as soon as possible would be the best option. So that was something, once again, I'd never even thought of or heard talked about or anything like that. So we decided to go that route of not doing the less invasive procedures and just kind of going for it.
And so who was this at the time? Was this your regular OBGYN you were having this conversation with?
Well, no, this was at the clinic when I had had my consultation.
Okay, the reason I was asking was because another thing I think you brought up, and I don't want to get ahead of you because I know you'll get to it, but just so for my clarity, I got the impression that you had a first experience at one clinic that was not great, and then you had a really great experience at another clinic. So I was just trying to figure out where this falls into the mix, because so far it sounds like you're getting some interesting advice that you seem happy with.
Yes,
okay.
that is true that I was. But this turned out to be the clinic that was not such a great experience.
Aha. So the initial advice was fine and dandy, but it's what happens after. Okay.
Right. So we decided to proceed with them. This was my first egg retrieval. They went pretty quickly into it. I think that my consultation was in July of 2020, and my first egg retrieval was in, I think, the second week of August in 2020. They really went fast. The kind of the problems that I was talking about with you. So the first day that I was to start my medication with them, you have to go in and get blood work and ultrasounds very frequently while you're doing an egg retrieval, every couple of days. So I was doing my first blood test and ultrasound to start my medication, and I could not get in touch with them to find out what my medication was. And, I was like, of course, freaking out because I was like very upset. You hear stories about people being treated like a number at an IVF clinic, and that was very much my experience. I remember freaking out to my husband saying like, oh my God, they just charged the credit card, the thousands of dollars that this retrieval is costing, and now I can't get a hold of them on the day that I need to start medication. And, I hadn't even been on medication, so it's not like I could continue what I was doing or anything. I had no idea what to do. And I finally got a hold of them at like 9:00 that night to get information on that. So I had the retrieval. Fast forward to after the retrieval, I had, I think, 2 eggs that were matured and going to be sent out to PGT testing, which is pre-implantation genetic testing, which they generally advise people over 40 to do. And for IVF, that actually really increases the likelihood of success, just right off the bat, if you know that you have something that, has been genetically tested. So they had the two embryos that were sent off, and when they came back, they did not pass. And I got a call from the doctor. It felt like a 90-second call. It was a very fast call of her saying, hey, I just want to let you know that didn't work out. Let me know if you want to go next month and we'll do another cycle. That was it. No other discussion. It was very cold and also just not very informative. What are we going to do? We're just going to do it again. And at that point, I was living in Orlando at the time, and I had been planning to move to South Florida. So I had been posting online asking moms about clinics in Miami. And I find Facebook groups, mom groups, to be so super helpful because I had so many responses. I probably had 60 responses or something like that. And I would say 85 to 90% of my responses were for one clinic, one practice in particular. Different doctors within the practice, but one practice. So that I felt like I got a really clear answer for where I wanted to go to next. And I was able to get a consultation with the doctor there. And I got a different feeling just in general from him talking about his plan for me. He was somewhat surprised about the medications that I was on and the dosages. And simultaneously, while this other consultation was happening, I did a consultation with a nurse from the first clinic to see what our plan was. And they basically said, we'll just do what we did it the last time. We're not going to do anything else, and we can do it next month and just kind of go to it. All you have to do is, pay for it once more, and then we'll go do it. So I decided to, switch clinics, and we were moving down to Boca anyways. And, so I was only 45 minutes away from the clinic in Miami. Very different experience at this clinic. This doctor, he first referred me to their nutritionist. She's their lifestyle, nutrition, and just kind of their wellness person. And it was unlike any type of nutritionist that I'd ever met before. A lot of times I myself, I used to hear the word nutritionist and think okay, this is somebody's theory on what nutrition is. I think that a lot of people can call themselves nutritionists, but she was a nutrition scientist, and she did everything based off of my blood work to customize everything. And I worked with her for a couple of months before we would proceed with an egg retrieval, because my doctor, he waits for her and all of the blood work to look optimal before he will do anything. So that right there was a big difference. We did all updated blood work for every single aspect, just to make sure that we were where we wanted to be. And for me personally, I tend to be a very naturally lean person that is not like they wanted me to have a little bit more body fat to be a little bit more conducive to pregnancy and to be a little bit more favorable to that. So I worked with this nutritionist, and she cut my workouts down to 3 days a week, and I was still working out because even she said, like one point I was still so lean at one point, and she's like, okay, well, let's see what we can do to like get your body fat up with food, because she's like, I'm not taking away those 3 days because I know that's your mental stress relief. So she really just kind of like worked with tailoring things to me and like what I needed medically for doing my IVF retrieval, and also what I needed mentally just for stress relief and going through the process. So, let's see. So just for like time reference for people, I had my consultation with my doctor in September of 2020. And I got the okay in January of 2021 to move forward with my nutritionist. And we did my first egg retrieval with my new clinic in February of 2021. Mm-hmm. So, and it's tough because I know whenever you want to have a baby and you're doing things, like you want to be doing it right now. You don't want to wait. IVF is a lot of waiting for cycles, waiting for a break between cycles, waiting for blood work, waiting for embryo tests. there's so much waiting. But what I found with my clinic that I was working with, it sometimes felt like things took a long time, but I know that they were doing everything they could to make things optimal and to give us the best likelihood of success.
Hey everyone, it's me, Tanya, your host here at the Mother Wit Podcast. I sometimes invite my clients on the show to talk about their birth stories and postpartum experiences, but I want to tell you a little bit more about what those clients and I actually do together. I started Mother Wit to help people in the perinatal period achieve their health and wellness goals. That means whether you're hoping to conceive and struggling with high blood pressure or high blood sugar, or you're having trouble managing anxiety or depression in the postpartum period, or maybe you just need support and advocacy between prenatal or postpartum visits, I can help. Get a discount on your first consultation with me at motherwitmaternity.com using the code FIRSTCONSULT 10% off. That's 10% symbol, all one word. I'm looking forward to working with you and maybe having you on the show too. Mm-hmm. I love so much of what you're saying about your second experience, and I think so much of this should be routine and standard. I get exactly what you mean when you say that first experience was very cold. I think that was the word you used. It was cold.
Yeah.
And how rude to charge someone an insane amount of money and then not be equally available. I mean, right. Maybe it's because I'm a lowly little midwife here, but I have a very affordable service, and the second someone pays me, I feel indebted to them, and I am immediately available to them. Mm-hmm. I can't even understand a world in which somebody's paying enormous sums of money and then they can't get a hold of their provider. I mean, that gets under my skin at a level.
It's crazy.
I can't even imagine. I would have been so furious, that I would probably burst into tears, because that's what happens when I get at that level of furious.
Oh yeah, so that day I was absolutely just beside myself. I did not know, I didn't know what else to do. I was reaching out. Yeah,
totally. And then the flip side being this really lovely respect for your natural state and what you as a human can bring to this, and the ways in which we can, I'm not sure this is the best word choice, but manipulate our own biochemistry to be as advantageous to the situation as possible. So I want to take you back, not for your sake, but for our listeners. When you talked about body fat, I want our listeners to be really clear that estrogen lives in our fat cells. That's why they said what they said to her. I just figured that was going to go over some people's heads, and I wanted to be really clear. So it is true that in the case of somebody who's extremely lean, if we need to get their estrogen levels up along with some other hormonal changes that can happen with that, we need them to put on some body fat. So if we understand energy expenditure at its most simplistic level, we have to either reduce energy output or take in more calories or both. And that's what they were playing with. And I love that because you don't see enough of that in fertility centers. I don't know if they had this or if you engaged in it, but I used to work with a person who's an acupuncturist, and she worked in our midwife center. This is years ago. And then she eventually ended up working with a reproductive endocrinologist, and her acupuncture, clinic, for lack of a better word, was in partnership with a fertility clinic because there's really good data that acupuncture can assist in increasing fertility rates. So they worked together for a long time, and I believe she's now struck out on her own and kind of has her own thing dealing with fertility, pregnancy, postpartum in the acupuncture world. But did they offer other services there in addition to the nutritionist?
At the clinic, no, but they do work with acupuncturists, and I was getting acupuncture all the way through, and I actually did, to touch back on that, I did acupuncture as soon as my husband and I started to try for our first son. So I was actually getting acupuncture before I got pregnant the first time. I got acupuncture done postpartum to help me recover with just hormonal recovery after I had my first son. So I was doing acupuncture in Orlando through that whole period of time when I was trying to get pregnant. It's definitely been a constant kind of thread for sure.
Yeah. Acupuncture is a funny thing, right? Because it can be sort of hard to study and hard to understand in a Western medicine sense. But we do have a couple of areas where the data in the Western medicine literature is really solid. Pain management is probably the top number one place where we can say for sure we've seen really good stuff. And then fertility is really high on that list also. So where we have that data that's clearer, I'm thrilled to hear that places are really taking advantage of that.
Yeah.
So can you talk just a little bit more? I don't know if there are specific instances, but I would love it if you could say for our clinicians listening, what were some of the things in your first experience that if you could get the ear of a clinician and say, hey, maybe don't do this or don't say this to people. Do you have any examples of things that you would love a clinician who's just listening in their own private world to hear you point out that were hurtful or harmful or just didn't help the situation at all?
Well, I think the first thing that you really stressed too was the fact that they weren't available to me. First of all, I mean, that's the really big one. Secondly, when you have to deliver bad news, I think that your demeanor and your bedside manner is a really big factor in that. Because like I said, that call that I got was so cold and just like crushing, really. It was really crushing, because the other thing is like being new in IVF at that point, I didn't realize how many procedures people really do go through. So I was just like, I don't even know what to think about this. And, they just left me with this cold call and no information too. It was just, if you want to go again, just call us and let us know,
And then that sends you spiraling, or maybe not you, but a lot of people spiraling about what does all this mean, right? Like if these embryos were not good, what does it mean for me in the future? Does that mean they're all not good, right? Like you start to spiral into these places because you don't have enough information.
You don't know anything. Yes. I mean, as I mentioned, I've done, I don't think I've mentioned it since we've been talking here today, but I did a total of 4 egg retrievals. And one of those retrievals, even at my clinic that was wonderful, I did not have a good retrieval. I had 4 eggs that came back that did not pass. And instead of me because just to explain a little bit, whenever I would do these, like they would send me each day, like if something had grown enough to be frozen, I would get an email telling me that, just kind of like this form email, like one embryo was matured and frozen and the biopsy was taken and it was sent out. So my doctor did not want me to get an email saying like 4 eggs did not, can't even be, actually those 4 embryos couldn't even be biopsied. And he called me, and he was just very caring in the way that he handled it. And he was like, I wanted to call you personally and let you know that the 4 embryos that we have, we could not even biopsy them. They were not healthy enough to even biopsy, and they didn't grow that well, well enough to even get to that point. And, he just expressed how sorry he was, and not even that, but like, I remember the tone of his voice. He was very genuine. He's a very genuine, caring doctor, and that really came through to me. So it's not that everything just worked out perfectly at my new clinic, and I never, I got some bad phone calls. I definitely did, and but it was how they handled it, and that was really, really just a whole different tone, and set up a different relationship to have with the clinic itself.
Yeah, and I think what you're touching on is, more important, or whatever, just on a different level of importance, to the idea of bedside manner, which is problematic throughout medicine in general. But it's this idea that people who go into the medical field, regardless of what you are at the end of the day, whether you're a doctor, a midwife, a nurse practitioner, et cetera, I want to believe that people get into this work because we crave and are potentially very good at human relationships and interactions. And yet it's hard when we're talking about things like this, because I see things in medical school and residency programs that I think beat that out of people. And the system further creates this barrier where we don't have time to be a certain way because we've got to move on and see the next patient, and all these things we've talked about ad nauseum on this show. But at the same time, there are people like myself and many, many other wonderful practitioners who just refuse to let go of this piece, and who find a way to connect with people even when time is limited, and all of these things. And then there are people who just don't. And that is such a problem. And that's what makes me say things like, we should have to have a bedside manner test before you're admitted into medical school or midwifery school, or any other school for that matter. But it's so interesting to hear you share your perspective on this journey that we know is so emotionally fraught, which I want to talk a little bit more about also, is the emotional piece.
Yeah. Well, also, just one other thing that I wanted to say is, like, at the first clinic that I was at, they didn't seem, I don't know if willing's the right word. They didn't even bring up doing other tests and, like, what else could we do to maybe understand a little bit better how to customize this. Whereas my clinic that I ended up working with, for the longer term of it, we covered every single base that we possibly could. And even things that other clinics might think weren't necessary or might not be helpful at that point, we did everything, and I think that, for something like this is a matter of growing your family or not growing your family. You're creating a life, it's a big deal. And if you need to turn every stone over, do it,
Well, the opposite of individualized medicine, which is what you got from the second place, is unfortunately cookie cutter medicine, which is like robotic. We follow this procedure. That's what we have. That's what we do. And unfortunately, that trickles down from the person with the highest level of education or degree, who's kind of ideally running the show and creating the idea behind the practice, down to the people who answer the telephone. Because if everything is robotic at the top, it gets more robotic as you work your way down through the staff levels, because their tool bag can only be as big as the person at the top. Mm-hmm. That's how I see it anyway.
Yes, I agree. Because at my second clinic, even like you said, everyone from the whole way down, mm-hmm. like at the second clinic, by the time, I'd had so many procedures by the end of this that like the women at the front desk knew me, and the nurses were like telling me, they're like, okay, I had to know if the pregnancy test was positive or not. Like they were like rooting for me, and they knew me, all the way, like the entire staff, like all the way through, for sure.
Yeah. So the second pregnancy that was IVF, was it a successful, easy pregnancy? Were there any issues with the pregnancy or the birth?
Yeah. Overall, it was very easy. I'd say the one difference was in the first trimester with my first son that I conceived naturally, I worked out, I lifted weights, probably 5 days, 5 days a week the whole entire time. With the IVF pregnancy, I did not, I was very inactive the first trimester. I did have a subchorionic hematoma, which is like a little bit of bleeding that happens. And
very common, usually not a problem. It's
and
something
very scary when it happens.
It sounds so scary. That word is one of the scariest things you can say. I mean, subchorionic hematoma. Just hear that word again. I mean, it sounds awful. And yet it's something that we find incidentally on tons and tons and tons of people. And although I don't mean to say to people who haven't gone through IVF that their pregnancies are less special or less important, but I hope that people can understand that when somebody has invested financially, been through the hormonal craziness that you go through, all the different levels of things you've gone through, that there's this sense of, and even you can say this from your first experience to your second, you didn't not work out the first time. You acted like you were a normal, healthy person. You were, but the second time you were more protective over this space because this might be my only shot. There's that feeling that this might be my only shot.
Well, and he was my only healthy embryo, so he was my only shot with this. So I mean, that was different in the first trimester, and I was extremely nauseous. I had complete food aversion. I lost weight, and that was like, that's like one of those things. I mean, it can happen. I know that can happen during pregnancy in the first trimester. It's not favorable, so we were trying to like minimize that as well as much as possible. I was on the anti-nausea medication, which helped somewhat. It helped me not feel completely nauseous. It didn't exactly help with the appetite so much, but I mean, typical like rough first trimester, I guess. And what was really interesting is I moved right around my 12th week of pregnancy, and since I was moving cities, I set up an appointment with an OB so I would have somebody to work with, just in case I need somebody to call. So I made sure I was meeting somebody right away that week, and I met with her, and she did an ultrasound, and she was looking, she's like, okay, you can go back to working out. And she's like, I have to tell you, this is just regular pregnancy now. You're good, which was amazing to hear. And also kind of touching on what you were just saying, when I met with this OB, she had such a relaxed, gentle rapport with me that I knew right away that she was the person for me. And, I don't know. I think that like when you meet a doctor or a provider, like, what, how do I feel around this person, and listen to that.
Absolutely. I love that. That's the advice for the clients, the healthcare consumers listening, is like, it's okay to listen to your gut. The other thing is, on that note, I hear a lot of people sticking with someone despite the messages that are counter to that.
I hear that so many times.
And I'm always a little dumbfounded at the level with which people are scared to change providers. And I don't want to minimize the feelings that people are having when I said that kind of offhanded and flippantly. But what I am trying to do is say, feel empowered to leave your provider if that's what you need to do to feel seen and heard and validated.
Absolutely.
I mean, that's what we have to do in order to better the whole system. There have to be factors for all involved. It can't only be one-sided where it's like, okay, let's work on getting the providers to be different in all these ways. Healthcare consumers need to interact with the system differently and put their foot down and say, I won't stand for this.
Yeah, I agree. But yeah, I mean, after that, it was pretty, I mean, it was a pretty basic pregnancy because I was 44. I did do a lot of ultrasounds and monitoring with like a fetal maternal specialty clinic. And I think it was even weekly after 32 weeks. So I they knew me. Everybody there knew me also. And that was another interesting kind of thing for me, because I tend to be someone who prefers less medication, intervention, or anything done if it's not necessary. As you said, I was very protective of this pregnancy because I really kind of wanted to do a birth center birth and bring my other son with us and, kind of have it be a family thing. But I also had this thing of, what if something happens? And I just, for me personally, I knew that I was going to go into it a little bit more relaxed. And so I made the decision for my own mental state, I guess. But my doctor at the fetal maternal specialty place, each week she'd be like, so did you set an induction date? And every week I was like, no, remember, we're just going to wait and see when he wants to come. And at first it really bothered me and kind of unnerved me because somebody's going to make me induce my baby. I don't, and if I didn't have to induce, I didn't want to. And so of course I went back to my OB and would talk to her, and she's like, it's okay. I'm your doctor. Yep. And if you don't want to induce, nobody's making you induce, She was very encouraging. And even my therapist was like, your fetal maternal specialist doctor, she sees the worst of the worst probably. And that's where she's coming from. She's not being mean to you by saying these things. But, it was something I just kind of had to get used to, where I was like, no, yep. I'm not planning an induction. And but finally by the end of it, she kind of got to know me, and she's like, okay, I know you're waiting to see when he wants to come,
And I think that is such an important piece of the puzzle. We may, on the medical side of the equation, come up with this plan that we try to implement for most people based on various characteristics. What is it about this pregnancy that makes it, quote, air quotes, high risk, all of that stuff. But it cannot be a cookie cutter, one size fits all approach. So you graciously said, put me through the weekly testing. I'm good with that. But you know what? When it comes to induction, I want to do a little more of a wait and see approach. And I'm going to go out on a limb and make an assumption that, of course, you would have changed your mind if something showed up on the testing. But your approach was, if my weekly testing is fine, I would like to wait for spontaneous labor. And from what I recall, from what you've already shared with me, you're very grateful that you did, right?
Yes.
Are you pregnant and thinking about what making milk for your baby will be like? Do you wonder why feeding human babies human milk has become so challenging? I'm Lo Nigrosh, a lactation consultant and host of the Milk Making Minutes, a podcast that explores baby feeding through the lens of systemic and cultural barriers. Come listen to others share their insight about their own milk-making experiences and empower yourself to feed your own babies in the way that feels best for you.
I had a very spontaneous labor. I said, in hindsight, maybe it's because I had already gone through childbirth prior to that, where I had a birth doula set lined up, and so I had been in touch with her throughout the pregnancy, and especially as I was getting closer, in touch with her more, and she would check in, and I was like, I have a little bit of cramping, and I was like, I think I really downplayed that, but I think it's because I had been through it before, maybe. But, with this one, it went from 0 to 60 so fast, so fast. It went from, I remember looking at the texts, afterwards in the timestamps with my doula it was 2:30, I think, or 2:40. And I was like, I'm kind of having a hard time staying in bed now. It's getting a little bit more intense. I think I'm going to have my husband draw a bath, and I'll just labor in the bathtub until I think I need you to come over to the house. And, but it was still pretty calm. So we drew the bath, and I had one contraction, and I thought, oh, this is why people have late water births. This is really relaxing in here. And I had 2 contractions, and I was like, okay, that's a lot more manageable. By my 3rd contraction, my body started pushing the baby. And I looked at my husband and I was like, we have to go right now, like right now. And of course it's the middle of the night. We had to find a friend to come over to be with my son and, rush to the hospital. And my husband and the security at hospital, they ran me in a wheelchair up to L&D, and he was born 4 minutes later. So, yeah. So he was very spontaneous.
For the record, almost every baby I've ever caught in a parking lot or on the front steps of the hospital is a second baby. It's always the second babies that come like that.
So fast.
And it's partly because the body really does know what to do. It is true that it's done it before. All of that is true. But I also think there's a psychological component where people try to do math that doesn't make any sense. There's no place for math. Yes. Yeah, you're nodding. Sure. Everybody does some bizarre math about their first birth and what it means for their second birth. And I'm always like, ay, this is why the baby's no coming out on the steps. Yeah. I know.
Yes. Yeah. Well, even after we got to the hospital, my husband has said, he was like, okay, well, just for a little bit of information, my first son, I was I was having continual contractions for over 30 hours with him. So it was much more drawn out. But, afterwards he was like, my husband said, I thought we were going to be at the hospital for, get settled into the delivery room for 45 minutes, an hour, maybe 2 hours, and then we'd have the baby. No, we were there 4 minutes. And so it was definitely a shock to both of us.
Okay. So as fun as that was, I love that part of the conversation. That was like my midwife heart right there. I do want you to talk a little bit about the mental health challenges that came with this second pregnancy. And I think, as I understand it, persisted into postpartum.
Yeah, somewhat. I definitely, I hit a point, sometime in the middle of IVF, kind of once you realize whoa, I'm really deep in this, where I remember I was actually I was on a wonderful beach vacation with my son and my husband for my birthday. And I remember I just kept crying, just spontaneously crying. And it really hit me of how depressed I was and that I definitely needed to get professional help, and I needed that support, that sort of just unbiased support. So, pretty quickly after that, I found somebody, and what I've since found, because that was in one city, I now live in another city. I've been able to find people who specialize in fertility therapy. You can if you look, you can find people who have experience in this, and oftentimes they have their own personal experience, and that's kind of what's drawn them into the field. So they have a lot of empathy and compassion. So I started seeing a therapist at that point, and continued through the pregnancy. When I moved during my pregnancy, I knew that it was something that I needed to continue, because I think that there's so many different levels of what's affecting a person going through this. Obviously the stress of it, the high stakes of bringing a life into the world, but then also the fact that you are consuming just an insane amount of hormones, just completely unnatural amounts of hormones are being injected in. I think that all of that piled on top of each other, it's just really heavy. And it doesn't just magically go away and disappear once you get that positive pregnancy test, because even throughout the pregnancy you have just a paranoia after having gone through so much to get pregnant. That I remember all through the pregnancy, I remember telling somebody I don't think I'll be able to just relax and breathe until I'm holding him. Then I'll be okay, he's actually here. Because when you go through years of trying to get there, it's hard to even believe that it's gonna end with you having the baby, because in IVF, there's so many steps where it can go wrong, where if you don't make, like when you hit one point, like if you don't get past that point, then you won't go to the next one. It's like there's so many barriers and so many like blocks that you have to like work through, that I think by the time that you are pregnant with your baby, it's just, I don't know, you're just very jaded and kind of like in just a little bit of like disbelief of like, is this actually going to happen? Is this really, really going to happen? So, so I continued, to get therapy after I was pregnant. And I still do, just because, I don't know, I see therapy as like one of those things that it can always help. And as, now as a mom of two, it's like, it's all different phases and different stages, but to get that, like I said, unbiased support, because you have your friends, you can always have your family and your partner, but like to have somebody who is unrelated to all of that is really, really helpful, I think.
Yeah, I completely agree. And I think this is a place where people who have experienced IVF and people who have experienced loss have a lot in common, because somebody may have had, 2 spontaneous pregnancies, but if they experienced a loss, regardless of how early it was, that next pregnancy is so deeply affected by the experience of the first. And it reminds me a lot of the struggles that I see people working through during pregnancy when it's an IVF pregnancy. And that's, again, part of where I was coming from when I drew comparisons to the way people experience and feel spontaneous pregnancies versus IVF pregnancies. By no means is that to minimize the spontaneous pregnancy group. It's to elevate the sort of emotionally heightened state of the others. So that's all really important. And I think that's definitely something providers need to be more attuned to, because we know how common, for example, miscarriage is. And we can get a little numb to talking about miscarriage, but there's nothing numbing about it when you're in a one-on-one situation with somebody and it's their experience. And I think it's exactly the same when we're dealing with people who have IVF.
Yeah.
On a final note, there's one other thing that you touched on that I think would be great to talk about that we've really not talked about at all on the show. Maybe it's come up like a little bit here and there, but you, I think, had some thoughts on what it means to be a mother that is older when you become a mother. And this is a topic I'm particularly fascinated with because, as I think our listeners know, I was a very young mother. I was pregnant at 19 years old, gave birth at 20. I only ever had the one child that I have, who's now 22. And with that said, I managed to surround myself, my community was older mothers. Most of my friends in the years my kid was young and growing up were easy 15 years older than me. Like they probably became mothers in their mid to late 30s, some of them possibly even older. And I was so acutely aware of the way we were different as parents. And I've watched those people, even now, the ones I'm still friends with our grown-up children, were really different parents. And I think that there is such interesting insights that the different age groups of parents can give to each other. So I'm really curious to hear your thoughts on this.
Well, for me personally, I think that having had the opportunity to have my long career is a huge, huge factor because, as I mentioned to you, I was really kind of ready to move on from that. I had worked in fashion really for like about 18 and a half years, so I felt like I'd kind of proved to myself what I needed to prove to myself with that. I had that like sort of lofty creative career that people don't think is going to be success. Like who goes into fashion design really, but I did it for many years and I supported myself in a very expensive city. And, I can feel like I had my accomplishments there. So I was able to walk away from that. And, and now I'm like a stay-at-home full-time mom and I don't have any regrets about my career. So that I really, really appreciate. And then one thing that I was actually talking to one of my friends before, one of my friends had her kids in her late 30s, and she was saying that she felt like as an older mom, you might have a different sense of time than maybe if you were younger, where I think that we feel very acutely aware of the fact that how fleeting these moments are, where I think maybe if I was younger, I might not have that same perspective. Obviously I have a nursing baby sleeping on me here. I'm like a very responsive parent, co-sleeping, nursing, it's a lot for a mom, but at the same time, I know that this is a season. This is such a short period of their lives. And, no one ever said having kids was easy. So, I think that I had a really realistic point of view, going into motherhood, that I didn't think that it was just going to be an easy walk in the park, because it's not. There, you got some like big little personalities that you deal with, and in these kids. So those two things, and then also, as I kind of like touched on before, I, as an adult, I really kind of developed my own spiritual practices, with meditation, and I think that has helped me parent differently, I guess. And in some ways, my meditation has changed over the years. I used to be somebody who would meditate for, sit on a pillow at my altar, for maybe an hour a day or something like that. And meditation, it's not like that anymore. My meditations might be 10 minutes now. But what I always tell myself is, instead of like sort of beating myself up for my meditations and my practice changing, as I've become a mother and I don't have the same time, I remind myself that like all those years of meditation, it's like training me for being present right now with my kids. And, I think that, having those years of experience with that has shaped who I am as a mom, for sure.
Every single thing you said really resonated with me in terms of what I've seen from my dear friends that were older when they became parents, and also spoke to the contrast of my own experience. I wholeheartedly agree with all of that. And at the same time, I'm perhaps jaded enough to think that even if there are young people listening to the show, which I've looked at my statistics, and young people actually don't listen to my show. So there's nobody probably in the camp of the early 20s having babies who listens to my show. It's actually pretty interesting, the age groups that I'm getting. But anyway, if young people find the show one day, I don't actually think that the words that you just spoke are going to change them or their experience, because it is that thing about time, right? Like when a kid's in the back seat saying, "Are we there yet?" It's because an hour of their life is proportionally so much greater than an hour of a 20-year-old's life, the hour of a 40-year-old's life. And I totally feel that now. But I look back and I recognize that although I wasn't a toddler saying, "Are we there yet?" at 20, I was the 20-year-old mom version of "Are we there yet?" Like every day was longer and harder for me than it was for a 40-year-old at that time.
Yeah. And one other thing about that too is, I feel that, like I've always said, I never thought I was going to become a mom at 40 and 44, but I have lived a very physically active life and been really into weightlifting and fitness for many, many years. And I can honestly say that, keeping up with a 4-year-old at 44 is no issue whatsoever, at all for me. And I'm really thankful for my fitness life, because I don't, I don't feel like an older mom in that sense, like physically. So, I mean, that, it's definitely possible to keep up with the kids, for sure.
Absolutely. And that's why it's always preferable that people have a good relationship with movement in some capacity prior to pregnancy. People who do have an easier time staying active during pregnancy, returning to activity postpartum. But because that's become less common, the way our modern lifestyle is, I get people coming to me for fitness support who are postpartum and saying, okay, I need help because this kid's getting heavy, this kid's moving fast, and I need to keep up. And I mean, one of the things I love, I've said this before, is that I'm thrilled, I'm over the moon that people don't come to me ever and say, like, help me, I want to be skinny. They say, I want to be strong. I want to have endurance. And people are really starting to understand the difference between like doing it for some aesthetic bullshit reason and doing it for functional reasons that really better our lives. And so that's been that's a change that's happening in my professional life that I'm just over the moon watching. Yeah,
for sure. Well, and I've also said, I was really grateful that I had a habit of working out set up for so many, like over a decade, of like lifting before I had kids, because it was so natural for me to stick with it, as you said, during pregnancy and afterwards, because afterwards I've said, like, if you didn't have that habit beforehand, it's hard. Like when you have a new baby and you're busy with that new kid, I get it. Like it's not an easy thing to add in, but I think that having that habit really does help.
Right, because if it's a habit, you crave it and you're trying to fit it in, as opposed to, I don't have this habit and now it's even harder to fit in. So I mean, I
trying to make it fit.
Yeah, absolutely.
For sure.
Absolutely.
So, yeah, I actually, just kind of an interesting thing is, I used to always get DEXA scans, for my body fat and my muscle mass and everything. And so I had it done before I had any kids. And then I had one done at 5 weeks postpartum with my first son. And as I said, I worked out the entire time. I lifted weights the whole time throughout the pregnancy. I eat really healthy. I lost like 18 pounds of muscle and I doubled my body fat.
And some of that is not because of what you did. It is what the body needs to do to support a healthy pregnancy.
And that's why I really had a lot of compassion for, women in postpartum, because, you hear so many people, like, they have a hard time losing the weight. They just, you hear all these struggles that women have. And when I saw those numbers, knowing what I did, even health-wise, my fitness and nutrition were still on point, and I still had those numbers changes. I was like, wow, this is why it's so hard for women postpartum. It was just really eye-opening to see the actual numbers.
And I'm not going to go down this rabbit hole, but I'm going to say it anyway. Aging is another piece of the puzzle where we could repeat parts of this conversation because of the way our body composition changes as we age. So, I think of postpartum as this like little window into what the lived experience will be for most of us as we go further, deeper into aging. And how we respond to this moment can give us some insight into how we might want to respond to aging over time. Anyway, rabbit hole we shouldn't go down.
Absolutely.
Star, thank you so much for taking the time to share your story and share your insights and perspectives. I think I loved those parts just as much.
Oh, well, thank you for having me.
Thank you for listening to the Mother Whip podcast. If any of the issues we discussed today resonate with you or your experience, I'd love to hear from you. Leave me a voicemail at 917-310-0573, or better yet, email me a voice memo at tanya@motherwhipmaternity.com. I really want to hear what worked for you, what didn't work, what support you'd wished you had, how you got through the tough times, how you advocated for yourself, or especially any tips you want to share with our listeners. I want to hear all of it. And if you'd really like to work together, you can get a discount on your first consultation with me at motherwhipmaternity.com using the code FIRSTCONSULT 10% off. That's 10% symbol, all one word. Okay, that's all. It's wonderful being in community with you all. Thanks again for listening, and see you next time.
And remember, listeners, nothing we discuss on this show should ever be considered medical advice. Please speak to your local provider about anything that comes up in this show that resonates with you and your needs and your health care.